Hello, everyone, and welcome to this audio podcast as part of the a Labostix Monstrosity. This is a scientific syndrome, and this is an audio podcast aligned to a Labostic monstrosity and a Labostic monstrosity intermission. And This is an audio podcast line to another Storm Labostix production. As part of this audio podcast, and this sort of intermission is there will be an overview in regard to looking at looking at an overview in around biomarkers aligned to biochemistry, and today at the same time the today at the same time there will be there is a webinar that's taking place by the Chief Scientific Officer as part of Healthcare Science Week, and and so as part of this, I thought again having having sort of looked at the sort of works that have been done have been done retrospectively. Uh, this again I thought this audio podcast would be an opportunity to provide sort of an overview in around looking at biomarkers and aligned to biomarkers and biochemistry. So in here there will be a bit of background, some background context, some context in around challenges facing healthcare, and in around specific disease, some aspects in around chronic kidney disease, or kidney care in the United Kingdom. In around biomarkers, there will be a sort of a basis in around FGF 23. There will be some focus. There will be some basis. There will be a basis in around the purposes of biomarkers, and then some aspects in around sustainability and transfer partnerships, or STPs. There will be some aspects in aligned to the role of education in healthcare from in context of allied health professionals, and some future prospective visions, some conclusions, and then in the descriptive on social media with this particular audio podcast intermission, there will be some information where listeners can check out some citations at their own time, to follow on to sort of follow on and identify similar works in around this audio podcast. So a bit of background. Between 2005 and 2015, the percentage of individuals over 65 years of age had climbed 21 around 21%, and continues to increase. Strong attempts have been required to avoid sort of renal insufficiency in support of in line to in line to sort of tech for in line to tech in context of those who are in who those for those within the population that are in suspect or high risk in around renal insufficiency. Technology should include aspects aligned to for example aligning particular side effects and comorbidities with particular medicines or medications, for example, and aligned to particular where particular comorbidities, for example, are either in between in primary care and aligned to secondary care as well. So whilst there are several definitions, there are several bases in around sort of the use of for example, multiple medications in context of prevention of particular diseases. For example, it is particularly an issue if suspect or high risks individuals within the population are prescribed more than two particular medicines to treat comorbidities and in line to specific medications, for example, is those medications that can prompt for example, can prompt effects in around nephrotoxic side effects or hepatotoxic side effects as well. And biomarkers, in context of this, biomarkers thus have an influence on the detection of renal insufficiency, and which can be defined as the kidneys inability to filter toxins from the blood, and where renal insufficiency prevention is an ongoing dilemma, because in primary care is hindered, has been hindered continuously, being informed that for example, acute kidney injury acute kidney injury, or AKI, prevention is pivotal. Now, at the same time, in around sort of challenges facing healthcare, and in particularly in context of in around CKD, in around CKD, it is recognized or has been documented as a silent and irreversible long-term condition. And CKD tends to establish itself as a secondary complication owing to other comorbidities between primary and secondary care. And individuals with CKD can tend to have a range of biochemical imbalances, including electrolytes, for example, sodium and potassium, and also where creatinine as a biomarker, but also as a byproduct of muscle breakdown, can prompt issues wherein there's an imbalance of the filtering components, i.e., for example, the nephrons, to rid of toxins and waste from the blood through urine. So the population is projected to increase had been projected to increase between 2012 2012 to 2032. Tech that streamlines and sort of integrates to sort of prompt the management of medicines, and reduces sort of aspects around polypharmacy, or the use of multiple meds or multiple medications, and encourages more timely screening, for example, and timely screening and referral referral between primary and health and secondary care healthcare sectors are and is important. So in around kidney care in the United Kingdom, specifically, so GP clinics or primary care surgeries have retrospectively been inundated with sort of complaints, but also have a selection of patients falling into chronic kidney disease, or CKD, and there is a requirement to sort of initiate treatment strategies earlier in order to prevent and delay the sort of both progression of CKD and the sort of comorbidities that lead into either AKI, acute kidney injury, or full-blown CKD. So current strategies are linked and rely on appropriate identification of suspect or high-risk patients in around kidney disease or CKD. And the total, sort of retrospectively, it had been documented that the total cost of kidney care in the United Kingdom between 2009 and 2010 was between 1.44 and 1.45 billion, which was about 1.3% of all National Health Service (NHS) spending in that particular year. In around tech and healthcare sort of education, and also aligned to sort of social media, all have a basis to play to streamline and integrate sort of aspects of health, and providing service users opportunities to interact in aspects of healthcare, but also to sort of propagate a sort of a basis in around aspects that align to sort of a sense of empowerment in around aspects of healthcare as well. So here now, sort of as part of this sort of intermission, and this basis, I thought it'd be here I thought it'd be quite good, to sort of provide a basis in around the purpose of or sort of the objectives in around sort of biomarkers. So using serum creatinine. So serum creatinine has been sort of the base, the sort of underpinning sort of biomarker for several decades. Using serum creatinine to obtain estimated glomerular filtration rate. So estimated glomerular filtration rate again is sort of a calculation used to determine renal insufficiency, and it has several constraints. In ordinary physiology. Serum creatinine is dependent on muscle mass and nutrition. Therefore, estimates in certain people, such as, for example, the elderly, bodybuilders, amputees, muscle wasting diseases, and vegans, should be interpreted with caution, and estimates will be greater or lower than the actual sort of titered level in around laboratory in around aspects of analysis and laboratory medicine. Now, measurements sort of derived from creatinine or serum creatinine are not always indicative, especially wherein the probability for fluctuations in around renal insufficiency are high, i.e., i.e. again, those sort of those sort of those sort of those sort of conditions as per mentioned and as per mentioned and creatinine is not typically or not always useful. It is simply used, has been used simply retrospectively historically, because in the main it is a cost has been a cost-effective option. So in around biomarkers, in around sort of additional biomarkers, that are biomarkers to detect CKD or renal insufficiency, the following are applicable. So creatinine, as per mentioned, or serum creatinine, is a reliable measurement. Reliable measurement of creatinine is necessary, has been necessary to assess renal function, and also to quantitate sort of drug levels and diagnostic compounds in urine samples or through urine samples. The most commonly used methods or modality are based on what has been referred as the Jaffe principle of alkaline creatinine pichuric acid complex color formation. However, other compounds commonly found in serum and urine may interfere with Jaffe creatinine measurements. Therefore, many laboratories have made sort of modifications to the basic method to remove or account for interfering substances. So in line to creatinine, another biomarker, or in line to creatinine or serum creatinine, another biomarker that has been sort of evidenced in works in sort of comparative works to with creatinine and serum creatinine is cystatin C. Now, cystatin C is a cysteine protease inhibitor that is produced by nearly all human cells, and the serum level of cystatin C is a sort of stronger predictor of renal outcome and the risk of particular comorbidity incidences than the have a cystatin C has a stronger predictor of particular renal in around particular aspects aligned to renal physiology and the risk of particular comorbidities than that of creatinine or serum creatinine levels. And the resistive index, or what's been referred to as the RI, in around renal Doppler ultrasonography is also a good predictor of vascular resistance, as well as the renal outcomes in recipients with CKD. However, it is unclear whether serum cystatin C is associated with signs of vascular dysfunction, such as the renal resistive index, or the RI. Another biomarker is that has been documented in some comparative investigations between cystatin C and also creatinine and serum creatinine is neutrophil gelatinase associated lipocalin, or NGAL. NGAL has also been evaluated as a biomarker of acute kidney injury in around renal transplantation or kidney transplantation. Biopsies of kidneys obtained in 1 hour after vascular anastomosis have revealed a significant correlation between NGAL staining intensity and the subsequent development of delayed graft function or allograft function. In a sort of prospective investigation of children and adults urine urine NGAL or NGAL concentrations in samples collected on the day of transplant clearly identified, for example, that cadaveric kidney recipients who subsequently developed delayed graft or allograft function, and thus required dialysis, hemodialysis or a form of renal replacement therapy, which typically occurred between 2 or 4 days later. Now, another biomarker that has been quite intriguing in aligned to particular investigations aligned to different forms of CKD, different forms of chronic kidney disease, different forms of chronic kidney disease for different sort of aspects for different aspects of investigation, is a biomarker referred to as FGF23. FGF23 is a bone-derived hormone that plays an important role in the regulation of phosphate and 1,2,5-dehydroxy vitamin D metabolism. FGF23 principally or pivotally acts in around the kidneys to induce urinary phosphate excretion and suppress 1,2,5-dihydroxy vitamin D synthesis in the presence of FGF receptor 1, FGFR1. Now, the link between FGF23 and FGF23 and creatinine or serum creatinine should hopefully listeners can get an idea in at least some context now that between FGF23 and serum creatinine or creatinine there is some overlaps in context of how these biomarkers are and could be used, since both of these particular biomarkers use similar sort of parameters or bases in context of particular investigations to determine renal insufficiency, since vitamin D in context of FGF23 FGF23 is a bone-derived hormone that plays an important role in the regulation of around vitamin D metabolism, and creatinine or serum creatinine is used to determine renal function through analyses and on the basis, or at least retrospectively on the basis by looking at aspects analyses and around where analysis is conducted around serum creatinine as a basis on as creatinine from being a product or byproduct of muscle breakdown. So there are similarities at least in some context around in around that in around that in around this. And so this now leads into something that's been referred to and is known in context of the renal literature or nephrology literature, and that is something that has been referred to as mineral bone disease. Now, despite metabolic improvements following in and around transplantation, recipients still often suffer from complex mineral and bone disease diseases as well. And so this then brings into prompts sort of a basis in looking at sort of these looking at sort of biomarkers, but also looking at this in context in a line and in context to a conundrum, being a conundrum and sort of a dilemma. So the number of people with multiple long-term conditions known as comorbidities or multimorbidities has already risen from 1.9 million from 2008 to 2.9 million in 2018. Added to this is that the pediatric population in around renal recipients also live longer also live longer, and the increase and the need for varied renal biomarkers has thus now become more pertinent. So this then brings us a specific focus onto in around FGF23. So FGF23, as per mentioned, is a bone-derived hormone that plays an important part in the regulation of phosphate and 1,125 dehydroxyvitamin D metabolism. It also principally acts in the kidney to induce urinary phosphate excretion and suppress 1,2,5 dehydroxy vitamin D synthesis in the presence of FGF receptor 1, FGFR1. FGF23 also sort of acts directly on the parathyroids to decrease parathyroid hormone synthesis and secretion. And in patients or recipients with CKD or renal insufficiency, FGF23 levels increase progressively to compensate for phosphate retention, but these elevated FGF23 levels fail to suppress the secretion of parathyroid, particularly in the setting of uremia. Now, routine sort of laboratory investigations and blood samples for biomarker for analyses had been in one investigation had been obtained at hospital admissions, and venous and blood samples were obtained, processed, and stored at -80 until the time of laboratory analysis. So levels of 125 dehydroxy vitamin D were determined at baseline with a fully automated and sensitive immunoassay that use vitamin D receptor ligand binding receptor ligand binding domain. FGF23 and something that has been referred to as left ventricular hypertrophy research, or where investigators had highlighted in works that the pathogenesis of LVH and highlighted that the pathogenesis of LVH and suggests chronically elevated FGF23 levels contribute directly to high rates of LVH and mortality in individuals with CKD. So the sort of basis in around this is that it is thus important to determine FGF23 against other variable renal biomarkers to help standardize renal care in different age groups and demographics and according to renal disease. Now, another basis in around this is that FGF23 again is for example, where FGF23 is a biomarker that, for example, could be more applicable, have more validity or viability on its use in the pediatrics or young patients going through different forms of CKD versus creatinine or serum creatinine, since with pediatrics and young people, since they are still developing or still growing into growing into sort of adults, for example, the FGF23 biomarker would be more applicable, would potentially be more applicable and viable, since it can be used. It can be used in a population in a pediatric or young population where the specialty, when in context of the specialty itself, sort of focus focus on the sort of the growth and the percentile growth and the percentile growth in context of young people as they grow, and also aligned to the endocrine system in context of endocrinology as well. Whereas serum creatinine historically, whilst it has been historically historically used in pediatrics and young people, at the same time it can potentially cause some sort of aspects of sort of misaligned analysis in context of pediatrics and young recipients in CKD versus those in the adult population with CKD. So FGF23 in this context should be is a biomarker, for example, that should be or could be considered, and as per mentioned, also cystatin C also for example, between for example FGF23 and cystatin C and creatinine, for example, serum creatinine, cystatin C would also be a viable sort of a biomarker in a pediatrics and young population as well. And there have been a few investigations in the United Kingdom, in around the United Kingdom around cystatin C. However, there have not been sort of any sort of formidable conclusions for cystatin C to be outrightly replacing creatinine or serum creatinine as a for example a replacement or a lead biomarker. And so this then leads into some works that have been developed as as an executive summary in around the in around 2017, where 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 um, where 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 a consortium highlighted through a publication in 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 a in the journal in the journal Kidney in the journal Kidney International, for example, where the authors provided a sort of provided a guideline update on in and around mineral and bone disorder in around chronic kidney disease, and in line to what's changed and why it matters. And this sort of executive summary that had been published highlights sort of a basis in around the different different biomarkers, but also in around sort of aspects of pathophysiology as well. It is a keynote paper, since there's in this works in around mineral and bone disease, in around mineral bone disease. The basis in around biomarkers had been and have been sort of documented in sort of MBD in mineral bone disease relating literature generally as well. So now in a little bit in around sustainability and transfer partnerships, and how this is important in context of laboratory medicine or pathology, but also in line to sort of in line to sort of biomarkers and sort of the analysis that sort of take place in line to pathology. So initiatives such as, for example, integrated care pathways, patient-centered care, and shared decision making are sort of example or attempts to align clinical and service user service user sort of guidelines aligned to aspects of aligned to particular aspects of healthcare. Now, STPs aim to sort of improve the coordination of care for patients or service users, but there is still healthcare fragmentation. The structural and cultural isolation between health sectors often results in sort of poor service user reported outcomes. STPs and sort of propagated and integrated care pathway implementers could stand to learn from, for example, online networks and online support groups, and in this context, for example, the Renal Patient Support Group, the RPSG. So, in line to this, the role of sort of the basis in around education in healthcare from allied health professionals. So more educational interventions are required, or had sort of retrospectively been documented, and this could help achieve this can help achieve sort of a sense of collaborative working and a sort of collaborative working, but also and specifically aligned to, for example, where multidisciplinary team efforts and sort of for example group consultations are concerned. So communication should be aligned to this. In the literature, it has been informed. In literature, there has been some informed sort of basis in around how communication should be sort of bidirectional to inform shared decision making, and especially where practices in around around sort of evidence practices aligned to for example aligned to, for example, polypharmacy, or to reduce basis in around polypharmacy and integration between chronic kidney disease and renal insufficiency, screening, renal care, and in line to sort of mineral bone disease, mineral bone disease sort of works as well. So in line to this as well, sort of the prospective goals or sort of the sort of work aspects in line to where investigators and sort of where policymakers could be, for example, more forthwith, is where for example the best way to appraise or get an understanding of which for example in context of this sort of outline or this as part of the remit in this sort of intermission, as part of this intermission, in context of biomarkers, which biomarkers should be implemented depends wholly on several factors. So, for example, as well, number one, clinical commissioning group, and sort of and how clinical commissioning groups clinical commissioning groups sort of implement aspects of funding. Number two, the national where national laboratory protocols, for example, biochemistry laboratories, to be more involved in informing decisive screening standard operating procedures. Number three, where patient scenario or situation analysis, i.e., for example, depending on sort of demographics and epidemiology, and four, a sort of a robust collaboration between health sectors, implementing aspects of initiative. So there will be sort of imbalances between sort of demographics, epidemiology, incidences, and prevalences, and different interventions and approaches to identifying renal insufficiency. However, it is important to see that there is a sort of more variability aligned to different biomarkers. Papers that have that are used to provide sort of so-called understanding in around biomarkers to established validity, generalizability, and relevance do not always meet objectives, and therefore service users at the same time want to be reassured that they are not unnecessarily being referred without a sort of without the sort of knowledge base in around particular laboratory analysis. So what is needed? So studies to compare and contrast 3 or 4 biomarkers in adult or pediatric populations, and also renal on renal replacement therapies versus those who are post-transplanted, relating and regarding to mineral bone disease, and to explore individual components of superiority rather than attempting a categorization of a one-size-fits-all, presuming all service users or patients should have the same screening methodology. So in around some recommendations, preventing unnecessary screening, implementing sort of biomarkers is an integral part of the disease pathway. Identifying which service users or patient population within the patient population has a high probability or susceptibility or suspect or high risk of CKD or renal insufficiency earlier is pivotal, and this will also help understand, number one, for example, whether scientists or healthcare scientists should be providing more effective sort of education and propagating more inclusive guidelines. Number two, whether healthcare scientists would find it more appropriate to have requests from frontline health professionals, for example, in around screening requests for cystatin C, FGF23, NGAL, and or creatinine or serum creatinine, rather than simply creatinine or serum creatinine alone. And number three, more biomarkers availability nationally ultimately would help detect which service users, patients or recipients should be referred more timely to secondary care owing to CKD or renal insufficiency, according to, for example, age and sort of demographics, incidences, and prevalences. So, in around some conclusions then. So, retrospectively, literacy has highlighted the importance of integrated healthcare records, electronic patient records, and healthcare records as well, to help understand sort of renal insufficiency prevalences. However, guideline implementation has varied owing to demographic and overall risk monitoring sort of nationally. Smarter at the same time, smaller smarter tech to an extent can and should sort of prompt adequate follow-ups for those newly detected with renal insufficiency or for example full-blown CKD. At the same time, cost-benefit analysis are potentially required to link reporting between, for example, dangerous polypharmacy and when to treat and when to and when to and when to uh, uh, and when to have laboratory practices, laboratory laboratory medicine uh, uh, involved in context and between primary and healthcare sectors, more specifically. At the same time, education and advice for patients or recipients or service users suspect or high risk for renal insufficiency should be a multidisciplinary effort. And where renal insufficiency or CKD screening is concerned at the same time, a range of biomarkers should be prompted or propagated depending on, for example, at the same time, the in around nephrotoxic nephrotoxic medications. So, for example, those medications that are used as for example, either pain relief or other particular conditions and comorbidities, or discrepancies for example, between estimated glomerular filtration rate, eGFR, and creatinine, which can be which can be and is affected uh, with sort of where creatinine again, being a byproduct of muscle breakdown. A cystatin C biomarker is and has been listed by the National Institute of Care Excellence guidelines for later stages of CKD investigations. But despite this, the cost of the assay has dampened the uptake of an in NHS laboratory investigation. NICE or the National Institute of Care Excellence need to also include, for example, need to also sort of propagate and have a basis in around biomarkers such as NGAL, FGF23, and creatinine as part of evidence base, and ensure that renal insufficiency and CKD risk is detected through looking at patient prevalences, incidences, and demographics, and not just simply inform that creatinine or serum creatinine is sort of the best is best because it's cost effective, and at the same time and finally, sort of smaller data will and should reduce admissions and reduce admissions, sort of hospital admissions, late referrals, and also sort of where patients can be sort of looked at in secondary care, but at the same time, where they can be sort of be discharged in a timely way as well. So that draws a close to this particular audio podcast aligned to this Labostix Monstrosity intermission, and this has been an audio podcast aligned to a Shientific syndrome. This has been the Shientist, and also where this audio podcast is aligned to another Storm Labostix production. Thank you for tuning in.